Two paramedics have been dispatched to a chest pains call, and thankfully these two understand the difference between a left and a right-sided myocardial infarction. The right side of the heart receives its blood from the system and pumps to the lungs. The left side of the heart receives its blood from the lungs and pumps to the system. During their first few minutes on scene, these paramedics obtain vital signs, conduct an assessment, take note of physical appearance, as well as ask patient about their medical history, allergies, and current medications. When an MI affects the left side of the heart, blood backs up into the lungs, creating pulmonary edema. The patient will be short of breath, so oxygen saturation levels as well as lung sounds should be obtained. When an MI affects the right side of the heart, blood backs up through the system into the extremities, often presenting with dependent edema, edema of the legs and arms. A late sign of edema that affects the whole system, or anasarca, is jugular vein distension. By utilizing 12-lead ECG technology, paramedics can determine which area of the heart is most affected by the AMI. Here is an example of a 12-lead ECG strip. Now let's talk about treatment. For a left-sided MI, where blood is backed up into the lungs, paramedics use nitroglycerin, which not only helps the coronary arteries to perfuse, but also helps drain the whole system. On the contrary, if we were to give additional fluid to our left-sided MI patient, we would only put more fluid in the lungs and result in a disastrous end. So, we as paramedics deliver nitroglycerin. Now, for the right-sided MI, where blood has backed up into the system, and instead of acting as preload for the right side of the heart, is down in the arms and legs, we will deliver additional fluid to increase the preload and deliver additional blood to the left side of the heart. Now, if we were to deliver nitroglycerin to the right side of the heart, it would simply drain the system, decreasing preload and afterload, and all around diminishing systemic circulation. Nitroglycerin kills the right-sided MI patient. Here, paramedics administer fluid to our right-sided MI patient. In summary, all paramedics should be able to recognize and treat left and right-sided MI patients. They should understand differential diagnosis for each and provide the correct treatment. Ultimately, for the MI patient, rapid transport is of utmost importance.
It's on some sort of training thing. Just don't let it defibrillate me, okay?
Just start laughing.
No, but no, check it out though.
Even if you use a part and we're saying,
Yeah,
you know what I mean?
that's true.
Again?
But think about, remember that time when...
Okay. You know what? I have an idea. Stop rolling.